Hello everybody, my name is Benedict Ley from the Menzies School of Health Research. Thank you very much for your time. I will now give you a brief introduction and overview of the procedures for the ACROSS study, the Appin Healthcare Facility assessment to determine populations at risks of malaria and primaquine-induced hemolysis in Laos. The objective of this survey will be to determine the prevalence of G6PD deficiency in patients with and without malaria. Secondly, to quantify the prevalence of malaria among febrile patients attending hospital. And thirdly, to evaluate novel diagnostics for malaria and G6PD deficiency. Now, these vary a little bit from site to site. In Laos, we will be specifically looking at a novel ultrasensitive malaria rapid diagnostic test. The ACROSS study is a series of surveys that follow a standardized protocol. Currently, we have 10 sites, Laos being one of them. Here you can see a map. Not included here is a site in Karachi in Pakistan, as well as one in West Papua in Timika. All sites included either do a hospital-based survey, a cross-sectional survey, or both surveys. In any case, all sites follow the exact same protocol, which will generate data that are directly comparable between sites later on. In Laos, we will be focusing on a hospital-based survey. The primary objective on which we based our sample size calculation was to assess whether there's a difference in G6PD deficiency prevalence between malaria patients and non-malaria controls. To quote from the protocol, to detect a least extreme odds ratio of 0.05 at two-sided confidence level of 95% and 80% power, assuming 15% procedural errors would require, and this is the essential part, 160 malaria patients, as well as 160 non-malaria controls enrolled in parallel at the same time. Here you can see a schematic overview of the study procedures. We will be screening patients attending the study hospital for inclusion criteria. All patients fitting the inclusion criteria will be invited to participate. And if these patients provide written informed consent, a brief interview will be conducted to collect some data directly from the patient. This is then followed by a medical exam from one of the study team members, and then followed by a sample collection, in this case a capillary blood sample. From the sample, a series of bedside diagnostics are being done, and the results of these diagnostics are then communicated directly to the participant. The collected sample needs to be stored at 4 to 8 degrees Celsius immediately, and then brought forward to a participating laboratory for additional processing. Samples will ultimately be stored and then shipped onwards for some reference testing. So in Laos, we will be doing a hospital-based survey. This does not comprise any follow-up. Every patient attending hospital is screened for inclusion criteria. Eligible is any patient attending hospital who is a resident of the study area, which has been defined earlier, who is actually attending the healthcare facility, who is at least 1 year of age, who has a body temperature above 37.5 degrees Celsius as measured axillary, or reports a history of fever in the last 2 days. Any patient who is found to be eligible is first of all informed about the study, informed about the objectives, what happens if he participates, what happens if the patient decides to refuse participation. He or she is then offered to participate and asked to provide written informed consent or assent. There is a separate presentation on this in much greater detail. However, I would like to emphasize at this point that no data or blood can be collected without consent. Once consent or assent has been collected, Some data will be collected directly from the participant, and this includes the date of birth or the age in case the date of birth is unknown, the sex, ethnicity, and so on and so forth. In addition, the participant will be asked whether he or she has had a history of fever in the last 2 days, a history of malaria within the last 6 months, what treatment he or she received for this malaria episode, and how malaria was confirmed. This is then followed by a physical exam, bedside test results, and laboratory test results. The medical exam is fairly basic and really only comprises of recording the weight of the participant in kilogram as well as the height of the participant in centimeters. In children below the age of 5 years, in addition, we will also collect the mid-upper arm circumference in millimeters. At the end of the interaction with the participant, blood is collected. A total of 400 microliters of capillary blood are collected in a microtainer. 400 microliters is a little bit less than half a milliliter. It's really not a lot if participants are unsure about this. Immediately after collection, the sample must be stored at 4 degrees Celsius until transported to the laboratory. It is quite essential that this cold chain is maintained. It is, however, just as essential that the sample is not frozen by accident. Either directly with the patient or later on in the laboratory, a malaria RDT is being done, ultrasensitive malaria RDT is being done, HB is measured, and G6PD status is determined. But we will discuss all of this in much greater detail in one of the following sessions. However, to give you a brief overview, a malaria slide will be done from the collected sample, and malaria microscopy will be read according to WHO guidelines. A malaria RDT will be done, an ultrasensitive malaria RDT will be done, which works more or less like any standard malaria RDT. A G6PD RDT will be done. Again, we will be talking more about this in one of the following sessions. The remaining blood sample that has not been used up will be stored as dried blood spots. And if possible, samples will be separated into plasma and pellet. The volume will be recorded and both will be stored at -20 degrees Celsius. Thank you very much for your attention. This really just was an overview. We will go more into detail on all of the specific procedures in a minute. Please don't hesitate to contact me or Jutta whenever anything is unclear. Thank you very much again.